Great. I think a few people are probably still joining, but I'll get started so that we can stick to time. So thank you all so much for joining us. I can see quite a few names that I recognise in the attendee list, so it's great that you've been able to make the time. Today's webinar really came about through kind of conversations that we've been having across the network. So I'll introduce myself first. So my name is Jess. I manage the network at the Consortium for Street Children. And as I think many of you have already been involved in or know about, we've been kind of speaking to the network about the implications of COVID-19 on street-connected children, both in terms of obviously the kind of the health impacts, but more importantly, the impacts on the kind of care that they're receiving through measures that are put in place to kind of public health measures to control the virus. So we've been having lots of conversations around how we can best support the network, and through that have been in touch with the Better Care Network, who've also been coordinating to get this webinar up and running. So some of you may have already seen in April, the Better Care Network and Alliance for Child Protection in Humanitarian Action and UNICEF published a technical note highlighting some of the specific alternative care needs of street-connected children as well as other vulnerable groups. And we kind of started a discussion around what might be needed in terms of additional guidance or support for kind of organisations and supporting street-connected children and looking at their care during the pandemic. We were really keen not to reinvent the wheel. We kind of know that there's a lot of guidance and notes and toolkits out there that have been produced, since kind of March onwards. So we thought that it would be a good idea really to bring organisations together and kind of experts who have been working with street connected children in different contexts to discuss what's happening for them on the ground, and to kind of share information and knowledge so that we can see if there are any particular challenges that would be useful to have some further guidance or support, or just to kind of have the conversation and broaden it out with others. So we've got 3 speakers who have joined us today. So we'll be hearing short presentations from them, followed by a panel discussion and then a Q&A. So there'll be plenty of opportunity for questions. Just before I introduce the speakers and get going, just a couple of housekeeping bits. So the session is being recorded, so we'll share the session afterwards. It will only be the people on camera, so attendees, you won't be able to turn your cameras on and speak. So if you have a question, you'll see in the bottom of your screen the Q&A function, so you can just go and ask a question at any point during the webinar in there, and then other people can also go and vote for or select questions that other people have asked that they're particularly interested in, and that way we can make sure that questions that quite a few of you have will be able to put to the panel speakers during the Q&A. So do put anything in there. There's also the chat function which is available. We'll be running a couple of polls during the webinar, and particularly looking at whether people are interested in a kind of follow-up webinar, and then if there is any kind of guidance or technical support people would like. So the polls will allow you to answer yes or no to those questions, and then if you could put any other suggestions in the chat, again, that can be at any point throughout the webinar, that would be fantastic. And if you have any other questions generally about kind of technical support or anything like that, just pop it in the chat function. And then we'll be sending the recording and a follow-up email afterwards. So I think that's everything in terms of housekeeping. So I'll introduce you to our 3 speakers. So we've got Vaibhav Sharma from Safe Society in India, Isabel Crowley from Juconi Mexico, and Shermin Moledina from Railway Children Africa in Tanzania. 3 fantastic organisations working with street-connected children who have prepared some short presentations. And then, as I said, we'll hear from each of those, and then we'll go through and have a panel discussion followed by Q&A. So I'll hand over to you, Vaibhav, if you can start, and then we can get going.
Yeah, good morning to all of you. Myself, Vaibhav. and myself from Safe Society, and we are working in mainly Uttar Pradesh. And in Uttar Pradesh, we are working in two cities, Gorakhpur and Lucknow. Our most affected area, that is street connected children in Gorakhpur and UP area, because the government and all other agencies who are not well thinking for these type of children, they are just thinking that these children are not very good for them. So we are advocating with the community and with the government as well in this perspective, and we are working from last 5 years with this type of children, and we have done a lot of work. Our main work for the children is to doing as a art therapy, because art therapy can support this type of children, and we also focusing some new innovative technology to reduce the mental trauma of these children. Before this COVID, we are intensely working with these type of children. We have established three centers where the street children are coming, and we are working with them. In these centers, we are working with art-based therapy and fun with learn and some alternative educations as well. So these type of activity we were working, and if the children are running away from their home, we have conducted many research with the children who are running away from their home, who are living at the streets, and this research can find out from our society website as well. So please next. Okay, the status of the state capital children during the COVID-19, because as anybody know that COVID-19 is the very problem phase for everyone, for everybody. It's not for the only street connected children, but the street connected children are most vulnerable and most impacted area where the street connected children are impacted about this. They faced a lot of problems because of the lockdown, because these children are daily wagers. Most of these children are daily wager. They earn money daily by daily and eat daily by daily. These children have no any savings, no any bank accounts. Most of the children have no Aadhaar card. Aadhaar card is the basic ID card for the India, and these children are no having the bank account as well. So this is daily routine, daily income, and daily expenses. So the suddenly lockdown announced in India, these children are starting facing a lot of problems in regard of getting food, getting safe spaces, because all public spaces where the children were living, like railway stations and bus stations, were closed. So for a safe space for these children was a big challenge for this type of children. And you can see the photo of a child who is just showing her body. During the lockdown, these children went for the food, where the food were distributed by the some NGO, and while he was returning, the policeman beaten him, because the policeman told him that you are walking in the during this lockdown. When he told that I don't have any space to leave and I need to go for the food, but the policeman was very insensitive. He doesn't understand his matter, and he just start beating him. The child was showing his body in front of us while we interacted with him. So these type of insensitivity of government authorities and this type of agencies who are responsible for the safety and security we are facing in India. And the main things that the accessibility of toilet and toilet soaps, ensuring the sanitizer and 2 meter distance from each one. These type, all these things are the very, we can say that this type of service is very luxury for these children, because during lockdown and during COVID they didn't get any service like this. They don't have the toilet soaps, they don't have the facility of toilets, and no any medical facility as well, because during the lockdown medical facility is fully closed, and because they don't have the mobile phones, most of them, and who have mobile phones, they don't have the money to recharge their mobile phones. So interconnection is again lost with these children. And the children who are living in relationship with other girls or other male boys, most of them are living in with their landlords. But during this lockdown, they are not able to earn any money. So their landlord just told them to get out from their homes. And these children, again, we have processed some children to go into rented houses. But again, the children came back to the streets. So it is very much problem for us, and it's very terrible for us as well. And the main things for the girls were forced many sexual compromises to get food and shelter support during this lockdown, because our field staff, child field support team went and met to the girls who are living at the street. They shared their very private and personal stories in the story of exploitation during this lockdown and all these things. This is very terrible for them and as well for us also. So please next. The advocacy actions we have started after knowing these type of problems. We have started some policy level interventions. We have raised this issue where the children were facing in front of the State Commission for Protection of Child Rights in UP. We have written the letter to them, and we also contacted to Child Welfare Department, Labor Department, UNICEF office in UP. Many district level efforts we have done to ensure the safety, security for these children. We have wrote a letter to India Prime Minister and highlighting these issues and problem of state connected children. We also collected many multi-stakeholder at one platform and discussed about the children's status, and we also suggest them the probable actions, what can be done over Zoom app. And we also, after that, the lockdown ended in India, we conducted a Zoom meeting with the government authority and the children who are living at the streets, and we just interacted, established a interaction with the children and government officers, so that government officers can understand the actual problems of these children. And we have also broadcasted many awareness messages regarding COVID with our community radio wing, and children were also participated in this activity. So this type of advocacy we have done, but we can say that when we wrote the letter to State Commission for Protection of Child Rights, they just wrote a letter to district magistrate to act upon it. But when we contacted to district magistrate is just saying that we will do on it, but they are not doing anything. Till now, they don't have any actions regarding this. So we are facing a lot of problems with the government level, because the senior authority is very much active. They are saying to do supports for these children. But when we are going to the grassroots level actions is not doing. They are not doing anything. They are just living their in own way. They are thinking this on their own way. So grassroots level is very much important to work and sensitize them. We have a lot of work and done, but it's very much problem to work with them. So please next. Action taken during this lockdown, we have supported to the children a lot of work we have done. We have supported them in way of packed food meal and ration support, who have their own family and own status in the rented home. We have provided emergency care support, medical medicines, alternate livelihood. We are just rebuilding that what they can do. We have developed the pro forma and format what they are want to do, and they are planning. And we are also developing a individual livelihood plan for these type of children. And we have also done the counseling and art-based therapy and convergence with government schemes to got benefit. In the UP, the UP Mukhyamantri, Chief Minister, launched a scheme for the child labor. Some of the children were maybe got benefited with these schemes. We have shared the list with the authority as well, and started a dedicated radio show with the state connected children to express their view as well. So this type of action we have done during the COVID. So next, please. So this is the situation of COVID-19. during the 2nd of July. We are in third top in the world, but still the situation of government is the same. So next. Yeah, this is the photograph, the pictures which we have done with the street cancer children. Next. Okay, thank you. This is our one photo of art-based therapy, which is you can see, and second, the children who are smiling faces after getting our support. So, thank you.
Thank you, Vaibhav. And in the interest of time, we can just move straight on. And then, as I mentioned before, if anyone has any questions about any of the presentations, please do start putting them in the Q&A so that we can put them to the speakers afterwards. But I'll pass straight over now to Isabel Crowley from Juconi, Mexico.
Hi. Well, it's very interesting to hear what Vaibhav said, because the situation is very much similar. We're very large countries with large populations. I mean, nothing compares with India. But in Mexico also we have many Mexicos. And the street children are in a particularly difficult one. And the street children that are facing the COVID even worse. So you can put the next one, please. Some of the, I mean, there's so many causes for what is happening to children in a context of connected with the street. But the basic one really is the poverty. I was looking at all the lists that Vaibhav had put, and you know, we could have put all those too, because we're suffering from exactly the same issues. But basically, I think a lot of it in terms of Mexico is poverty. You know, the same as Vaibhav said, people have to go out and work so that they can eat. And if we have a huge population that can't eat, then there will be a revolution. And so the government can't also enforce many of the COVID issues that they have put on the table, so that people also have to do, like wash your hands, you know, keep a safe distance. Well, you know, in the populations we're working for, that just doesn't work. They don't have soap, they don't have water, they don't have to eat. So I think the majority of the families really, and the children in Mexico are very connected with the families. They all have a family somewhere. And so the majority of them are really suffering multiple deprivations, and a lot of them are single parents, especially female-headed households. And so in that case, really makes even more difficult for the mothers to look after the kids, and the kids are forced into the streets. And the other issue is that the families are very, there's lots of children all the time, and as we know, more than 50% are kids. But in fact, what happens is that they're from various parents and various fathers. And so it becomes also, in terms of relationships, very difficult. When we look also where their homes are located, are in the urban periphery, the more difficult access areas, and also the ones that don't have the basic services. When we talk about the informal work, all of them are involved in some way in informal work. And in fact, a lot of them migrate, are IDPs, international displaced people, around Mexico, depending, you know, if they are harvesting something in one area, not the other, and they're selling chiclets, and we know exactly where they're coming from, but it's very difficult to also provide services to them because they're moving all the time. Also, in terms of education, the government has put has got a plan for COVID for children, but really it's a very luxurious plan, because it doesn't serve the most disadvantaged children, which are the ones we're dealing with. Also, in terms, one thing that is never talked, but it's always there, is migration. We have a lot of migration, as you know. The corridor from Guatemala, El Salvador, and Honduras is through Mexico to go up to the United States. So we've got different, we have 32 states, and we've got different situations in the south of the country when the migrants are coming through, and on the top when with the border with the United States. And COVID in those areas is very prevalent. Also, in those communities, they're saying that more than 50% of the ones that are tested have COVID. And of course, those are the ones that are tested, which is really a minority. So the other area is that is very invisible are the domestic workers. The domestic workers also, which we don't see, but they are there, and they are also suffering enormous deprivations because either they've been told to go to their homes, or they've been told to stay at home and continue to be exploited, and actually are not giving what it's needed to really be able to defend themselves against the COVID. So many of these dynamics are the ones that are underplaying in the context of Mexico. The next one, please. I think it's early in the morning here, so we're still very croaking. I just put Mexico population. Of course, Vaibhav will put another 0, and then we'll be more or less like India. But these are the confirmed cases and the accumulated deaths. According to the Wall Street Journal, the New York Times, if you multiply that by 5 or 6, we've got the correct estimates, because there are no testing being done. I think the government is saving their money for if we have a vaccine, and so, you know, the people are dying at home, and the hospitals are full. Mexico City, 25 million people. Many of the hospitals that this type of people would be going are just full, and they're not attending a number of people. Of these 127 million, 40 million, just to give you an idea, are children and youth, up to, of course, according to the CRC, up to 18. And 52%, or about 21 million, are living in the poverty line, and 5 million are in extreme poverty. So those are the figures that we have. And according to migration, we've got around 100,000 children that are migrating through the country at any one time. And those figures are also, in terms of migration, is very difficult to determine if they're correct. We think they are the top of the iceberg, because only about 20% of the migrants enter in contact with the authorities, usually either through in contact with the law, or if they've got an accident and they are in very difficult situations. We also have a very different dynamic, which is a bit like the United States, Brazil, and in fact, we are a federal state. So although at federal level, there can be some policies made, in fact, you need to go at the 3 levels, the state level and the municipal level, because there are lots of difference between states, because the states are actually very independent, a bit like the United States, really. Of course, the lack of education. You know, when we say that we are providing education to all the children, 44% of the households have a computer, but sometimes they don't have it, and 7% do not have internet connection or cannot afford it. And the situations of domestic violence have increased during the confinement. So these are some of the things that we are talking about, and also the one I just mentioned about the financial support for the family. These families can't stay at home. These families have to go into the streets and have to go and fight for some money so that they can eat. And so in that sense, you know, this is some of our our interventions are very much on that regard. The other thing that has happened, and what we think worldwide, 1.5 billion children are not really attending school. But one thing that has also happened in Mexico, and I think maybe in many other countries that are listening, is that the price of the petrol, the drum, has gone down tremendously. And so the income that the government has for the normal expenses has been reduced by more than, well, the officials are cutting the budgets by 75%. And so that is definitely also putting a very strong handicap on the condition of services from the government. Can you go to the next one, please? Okay, some of the things that we are doing, but I'm just putting in terms of what to do as organizations. We have to change the way we work. There was no other way. We have to find the families where they are and the children where they are. We have to support their health situations. By providing funds, of course, in many instances, and some of our children also were on medication. So, we have to continue to do that and make sure that we know where they are. It's essential that the fathers and the mothers have support structures to improve the quality of the relationships. So we're very, very worried about violence in the families, and we're very, very worried about also what can we do in terms of mental health. What is done also for the children that is sustainable, because of course depends on the age of the kids. A little baby has got certain needs, but another 6-year-old has different needs, and parents have got teenagers have got different needs. So how can we ensure that our families, at least, and the families that we are supporting, have got that have got those tools now? So basically, what we are saying, we have to have an integrated approach to what we do. We completely change the way we work, and I think we will talk a little bit more how we're doing. But basically, the back office, so the administrative, all the people that could stay at home are staying at home. The center where we have the children, and the center where we have the young adults are open, and we are having people that come every week and stay the whole week with them, to avoid them going by buses and stuff like that, which are the big contaminators and the incubators of many of the COVID. And also looking at the voice of children. How can we ensure that the families pay attention and listen to what the children are telling them? Their fears, their worries, the things that they want it to be. I mean, especially, I think the young adults are really having a very difficult time in this time of COVID. We also have a very different approach from many organizations. We've got a therapeutic approach, so we're dealing quite a lot on this mental health. And so we are also now starting to think very clearly, and goodness knows when that is going to come. Here we call it the new normality, but they're now talking about the porcine flu. They're talking about the flu, and they're talking about all the other things that we can expect during winter. And so that is going to put another pressure on everything that we do. But we also...
Do you mind if I just jump in? Sorry, just in the interest of time, if you're able to wrap up so that we can...
We can go to the next page. We can be talking for hours, as you know. So we basically operate...
Thank you.
We are operating with the families, and we really are doing things via telephone and online. And these are the things that type of aid that was granted to the families to face the contingency. But I think we can talk about that a little bit more on the next one when we talk about questions and answers. Thank you.
Great. Thank you very much. Sorry to move you along. I'm just in the
That's good.
time, and I'm sorry
Good
I'm
talk.
anyone on Zoom longer than they planned to be. So I'll hand straight over to Shermin. You give yours, and then we can go to the panel discussion after that. And again, a reminder to anyone, if you have any questions, do just put them in the Q&A. Any questions for the speakers that we can put to them a bit later on. Thank you.
Thank you, Jessica. I'm delighted to be here today. Thank you, Consortium for Street Children and Better Care Network, for organizing this webinar and for inviting us to share our experience. But thank you also to all the attendees for taking your time to attend. So as Jessica said, I work with Railway Children Africa, and we're a subsidiary of Railway Children UK. We work in Tanzania and Kenya with children and youth living and working on the street. But my presentation today will be sharing our work and our experience in Tanzania, especially during the pandemic. So we have a three-step agenda that starts with meeting the immediate needs of children and youth on the street. We have an extensive street outreach program where we access children and youth, build relationships with them, and through that rescue, protect, and support them by providing services and opportunities that enable them to eventually reintegrate into safe families and communities. We also work quite closely with communities that are close to the children to challenge their perceptions and to shift their perceptions by creating awareness on what drives them to the streets in the first place and mobilizing community actors to take protective actions. And we also advocate for the rights of street-connected children from grassroots to government to ensure that they access protection, services, and opportunities to thrive. So given our limited time today, we were told to prepare very short presentations. I'll primarily be talking very broadly in terms of the elements of our work that relate to our service provision, but we'll also touch on advocacy that we had to ensure that we continue to do so that service provision could continue. Our service provision is very much grounded in the recognition that the children that we work with have experienced abuse and neglect, both in their families and on the streets. And the situation was obviously worsened further, as has been pointed out, in India and Mexico during COVID. So this was something that we had to continue to work with children both on the streets and with families. We work to reconnect and help strengthen families and break cycles of abuse. And as you would all know, this is something that takes quite a bit of time. So we as well use a therapeutic methodology that focuses on addressing trauma and poor attachment in families, and in doing so enables the child to remain in a safe home. So a little bit about our context, to provide some background information. Tanzania is a country in East Africa with a population of almost 60 million. 63% of the population is rural, and the median age in Tanzania is 18 years old. Pre-COVID, poverty rates declined, but the actual number of people in poverty remains very high due to a high population growth. Next slide, please. So a little bit about the COVID situation in Tanzania. The first reported case was declared on 16th of March. Schools shut down on the 17th of March. And I'm not sure if I should say luckily, we didn't have a lockdown. Time will tell. But we didn't have a lockdown or curfews. And so really a lot of things continued as normal, with the exception of the fact that there was no longer a lot of businesses operating because of there not being as many tourists coming in. So there was a lot of changes in that sense, but people were trying to go about their daily work as best as they could to survive. By early June, the president declared that Tanzania is corona-free, and the data stopped coming to us around the 29th of April. So on 29th of April, we had 509 confirmed cases reported and 21 deaths. But due to the lack of transparency, we've continued to operate assuming there is COVID, and we continue to take precautions to keep our staff and children safe. So what did we do? Well, given the lack of access to services, as other presenters have also highlighted, we felt it was absolutely vital to continue to provide services and protection at this point. And so we immediately advocated with government for service provision to continue. And at the time, we weren't sure if there would be a lockdown or not. So we started to prepare and come up with scenarios. In the event that there was a lockdown, what will we do? And in the event that there wasn't, how would we continue to operate? So like others, we had to also adapt our service provision. And something that was really, really key to how we started to operate was we started to talk a lot with everybody. We had a lot of coordination meetings amongst ourselves, amongst our CSO partners that we work with, and with government. And it was really key to enabling us to continue to monitor the situation, to keep our fingers on the pulse, to provide guidance, and to be able to proactively problem solve, to continuously be ahead of assessing risk, and to actively monitor the impact of COVID on street-connected children. The other thing, next slide, please. As I mentioned, that we really strengthened was our risk assessment processes. And as part of that, developed a number of guidelines to guide ourselves and our partners on how to operate during COVID while ensuring that children and staff remain safe. So some of the guidelines that we developed was how to continue with family work, how to continue with our street outreach, as well as operating our drop-in centers, as well as measures that staff needed to take while they were visiting with families or traveling for reunification or working with children on the streets. Staff were obviously provided with PPEs. Children and families were provided with masks, soap, and washing facilities. And we also worked through our network of community champions in the 6 cities that we work in to help supply hygiene materials and referrals to children and youth. Next slide, please. So we had to also adapt our case management response while we continued to provide home visits to vulnerable families, and we had a way that we were assessing which families those were. We really ramped up our telephone support for families. And the telephone support was obviously for families that didn't have as high risk, but for those families that may have seemed stable pre-COVID, we decided we cannot graduate these guys right now. We can't disengage services at the moment, given the strains that COVID is placing on all of us. And so we continue to provide services to them even during this time. One of the things that we did, whether it was during the home visits or during the telephone follow-ups, is to ensure that we spoke to children and as much as possible spoke to them separately so that if there was any safeguarding concerns or issues, that these would be reported. And then we, of course, continue to provide food, medical, and psychosocial support to children and families during this time. So to touch a little bit on the advocacy that we had to do, we had to engage simultaneously at national as well as district and regional level. While we have one government, the regional authorities do have some powers to go ahead and do certain things in spite of what national level sort of authorities may say. And so we really had to simultaneously work and position ourselves because there wasn't really any guidance coming from the government about how to work with most vulnerable children. They were looking to us, and it was a real opportunity for us to lead and to influence this process. So we were on a number of national level task forces that were chaired by the Commissioner for Social Welfare and engaging at that level. But as we all know, those processes take time. There's a lot of layers of bureaucracy. So we were also very much engaging at the local level with our district authorities. And we had preempted roundups would happen. And so we started to talk to the government about allowing us to advise and support efforts in the 6 cities, especially where we operate and where our partners work, to try to influence how the removal of children, for lack of a better word, what was taking place. Luckily, we were able to influence the safe removal in 4 of the 6 cities. In 2 of the other cities, not so much. And perhaps later on, we can talk a little bit about why that is. But if you move to the next slide, I think one of the things that we really realized is how important these relationships that have been established over years and years with the various duty bearers and the people that are the decision makers really is, especially when it comes to a situation like this. So because of those established relationships, we were able to influence to some extent, not, as you saw, not 100%, but to some extent, you know, how certain measures should be taken. And so really what ended up happening when the government said, let's round up, in 4 of the cities, we were able to access the children on the street, explain to them the reasons for why government wanted to remove them from that environment, place them in residential centers temporarily, and try to reunify them home. Now, again, because we've run out of time, I'm not going to be able to share all of the challenges. It wasn't all smooth sailing, but we were definitely able to work together with a number of different actors, including government, to try to do that. So I think one of the things as well that we learned is government being responsive to street-connected children really requires investing extensively over time in exposing duty bearers to our work, our methodologies, and creating empathy for street-connected children. One of the challenges as well is you've established these relationships, you've engaged people through time and in the various methodologies, but then they get transferred and they move elsewhere. So you have to start all over again. But we continue to persevere and strategize as needed. So next slide, the situation now. Basically, children went back to school last week, and we're all, you know, families are trying to recover financially. So the real impact will be over the next months as we continue to reach and work with children who are otherwise forgotten. But our service provision continues while we continue to take precautions to minimize COVID transmission. We continue to advocate with government so that if children are to be removed from the streets, that it's done safely. And we are not graduating families for now, even if they were ready pre-COVID, so that we can continue to provide the very necessary support and monitor what's going on. Thank you very much for your time. Asanteni.
Thank you, Shermin. I'm going to pass straight over now to Lizette, who is the Head of Research and Advocacy at the Consortium for Street Children, to go into the panel discussion. We'll be looking more at some of the specific kind of care implications that COVID has had on street-connected children, and you touched on it briefly, Shermin, but some of the challenges that organisations have been facing. Quite a few people have put messages and questions through in the Q&A, so please do continue to do that as the panel discussion unfolds, and I'll be sharing those questions with Lizette so they can get put directly to the speakers during the Q&A. So I'll pass over to you, Lizette.
Thank you, Jess, and thank you, Vaibhav, Isabel, and Shermin. It's been really helpful to hear from you what kind of the context is a little bit before we start going into more detail of what the care implications actually are for street-connected children during this pandemic. I want to just ask a few questions to the different speakers to kind of get the discussion going a little bit more about, you know, what are some of these care implications that we are looking at, that street children are facing during this trying time. And as Jess was saying, please do send any questions in the Q&A, because we'll have some time afterwards to pick some questions from the audience as well that we'll pose to the speakers. And you can also like questions that others have already asked in the Q&A. If you think, oh, that's a great question, I'd like the answer to that as well, you can like them so that we can see which questions are you're particularly interested in, and then we can pick those out. Our first question that we have for the speakers kind of focuses around some of the quarantine and isolation measures that governments have put in place. So many governments put in place, you know, isolation measures, lockdowns. We heard in India and in Mexico, although there was not a lockdown in Tanzania, as we heard. But how have some of these measures from the government actually impacted on street-connected children? were they put into detention centers as a result? We heard some from Vaibhav a bit about police violence as well, if they found children on the streets during lockdowns. So let's start with Vaibhav. If you can talk a little bit more about how some of these measures impacted street-connected children during this pandemic.
Thank you. Actually, as I told in my presentation, that government were not very much interested with these children. They just, when we starting through initiate them that these children were living this area and this area, and these children were living in open area, open spaces as well. So we requested them to put them into their quarantine center or any isolation, but they didn't plan anything for these children. Most of the children were goes to the railway colonies, because in India the railway colonies is very big colonies, and they are very outhouses as well, and some garden as well. So most of the children and families went there and start living there in that open area, and some in outhouses or the servant quarters for the railway officers who don't, because during those COVID most of the servants were left their job and went back to their home. So these street children served this facilities to their in the railway quarters, the railway authorities and railway persons as well. They supported them, and they just gave them the space to live in this this lockdown. So this is very problem, and the drop-in center, we can say that there is no facility of drop-in center for the children who are permanently living at the station. They only have drop-in center and some shelter homes and this type of shelter for the children who are the CNCP children, children need of care and protection, and children who are conflict with law. And these children are directly come from the child welfare committees as per the JJ Act and or Juvenile Justice Board in India. So government is not very much interested for these children. So as per my opinion and as per my experience, there is no any facilities from the government side. Most of the children were forced to live here and there. They don't have any good facility of stay and drop-in center as well. So this is very problem for the children.
Thanks, Vaibhav. And just to kind of build on that a little bit, how has this been done in Tanzania, Shermin? Can you talk a little bit more about any residential care facilities that children have been placed into as a result of any measures or as a result of the pandemic? How do they work, and how do they ensure that children aren't put into residential care facilities and then just end up staying there, but that it is kind of a temporary solution, and that other alternative care solutions are still being explored with these children?
Yeah, I mean, the situation has been really challenging during COVID because there's been a real push to get the kids off the street. And that push has been coming mostly from the government, where they've been saying, we've got to get them off for their safety. And given the absence of any other alternative care measures other than residential centers, oftentimes that has been where the children have been placed. Now, we do have a fit persons system that we're trying to develop, which is kind of similar to some extent to a foster care, but doesn't quite operate in the same way. But there's just not enough fit persons around to be able to have kids stay with families. And so, yes, that was pretty much what the government was resorting to when they would remove the children, placing them in residential facilities. But then unfortunately, these residential facilities, even under normal circumstances, don't have enough resources. And so you'd find that children were not being fed, they were not being adequately supervised, there wasn't proper staff involved to actually provide the various levels of support that they needed. And so trying to coordinate all the different actors and trying to deal with the growing number of children that were being placed in care was a real challenge. And I would say a lot of it had to do with a lack of sort of coordination and leadership, which we tried to, influence as much as we could, but it was very much driven by the government. So, that's a challenge and a tension that continues to remain as we try to influence and be part of and lead, but at the end of the day, have very little power about what ultimately ends up happening. So a number of children were returned home, but some ended up just going back to the streets. Some in other cities were forcefully returned home because the processes weren't always followed to ensure that children were being safeguarded, or case management processes to properly assess what was happening. And so some of those children have come back to the streets. Luckily, we've been able to engage one of the local government authorities. This week, actually, we'll be evaluating the outcomes of the roundups to reflect a little bit more and say, okay, well, did that work? Okay, what worked? And if it didn't work, then, can we maybe try and do things differently? Because clearly this situation is here to stay, even though we've been told we're corona-free. And the roundups of children is not new for us in Tanzania. That's always been happening even before corona happened. So
have children been placed into detention after they've been rounded up, or?
As far as we know, not detention. It's always been residential facilities, which has meant that they can come and go as they wish. And so, yeah, it has resulted in some kids just leaving after a night or two, because obviously, as we understand, the situation is quite complex. It's not as simple as, returning them home. If we can't actually properly address what brought them to the streets in the first place, they are going to come back.
Thanks. I'm just going to move to the second question in the interest of time. So I'll come to Isabel for the second question. And it'll be interesting to hear a little bit more whether this pandemic has actually driven more children onto the streets. We've seen and heard quite a bit about, children being pushed off the streets, but, various factors that resulted from the pandemic and measures taken to stem the pandemic. What's been your experience in Mexico?
Yes, in Mexico, well, the children are on the streets. They are not even the government. They've got some facilities. Again, I think there are bigger facilities in Mexico City than in the other cities. But in fact, they just go there and have a shower or can have a meal. But those facilities are very, as Sherman was saying, are very patchy, and it depends very much what they offer, and depends per state. So to answer your question, I don't think that as they've driven more children to the streets. The children were already on the streets, and the situations are similar. They have not changed. The way we are dealing when working with them and listening to them is changed quite a lot. Has given us also others opportunities, and the key challenges is really again the same thing. How can they access? Although we are with the government, we'll talk about our relationship with the government and the NGOs. But what are the key challenges these children face are the same. Now, in addition to not having a proper place to eat and stay, and they also, many of them, have got COVID. And so what we are trying to help is to help them to have the food that they need, to have the mental health support that they also need, and to also, in some instances, give medicines, specialized medicines in particular too, because some of them were also, as I said, on medicine. So basically, talking with your colleagues just before, no, we don't have centers. There is no way. The only people that are in centers are the migrants, and they put a lot of the migrants, especially at the border towns, in big centers where there is no distance, no distance between one and the other, and they don't have all the necessities that we talk about for COVID-19. As a result, we are told that more than 50%. And I think that's quite an underestimation. They suffer from COVID and many are dying. And also the statistics of the ones that are dying are not available. We just heard today that maybe Mexico is going to start not telling how many people died because they don't think it's relevant. So those are the things with whom we're working with.
Yeah, that's very challenging. It's incredibly difficult to collect this kind of data at the moment as well. Absolutely.
Yeah.
Vaibhav, what's been your experience in India when it comes to the number as well as the type of children that have come onto the streets? Have you seen an increase in the number, a decrease, or have you seen different types of children that need care on the streets?
Yeah, we can see the increase of the children at the streets during this lockdown and this pandemic. And not only children, the families are also at the streets, the increasing number. And the shifting of the place is as well. The children who are previously living, it's not right now living there, they have shifted in some small pockets. But most of the, we can see that near to 30 to 40% peoples with families and the children were landed at the station or landed at the streets during this lockdown. We can see this increase as well.
Thanks. Yeah. I'm going to have to keep moving on, unfortunately. There's so many follow-up questions I want to ask and dig into this further, but we're already a little bit behind time. So I want to move on to the third question. We've talked a little bit or heard a little bit from the speakers already about the importance of supporting families and promoting family reunification, but also, challenges in continuing to do so when there are restrictive measures in place, when movement is more difficult. So my question really is to how, when family reunification is so important, when children need a safe place to be, how to do that kind of follow-up to make sure that when children do reunite with their families, that this is actually safe for them to do so, that they come into a situation that is safe for them, where they are cared for, where they're nurtured, where they're not at an increased risk of, for instance, domestic violence. So how to do that follow-up when there's kind of limited ability to move around the country, when there's social distancing measures in place, etc. So maybe Shermin, if you can elaborate a little bit on that, and then we'll come to Isabel afterwards.
Yes. So again, I'm not sure if I should say luckily, but because we were able to move around, we were able to continue to access families. But we did have to ensure the safety of our staff and the families and children. And so, especially during what was apparently the peak in April, May, we were only visiting families that we assessed to be at high risk. And so we came up with internal guidelines, for those families that we were already aware that had a lot of issues with regard to violence, for those families that we were already aware, for example, who had recently been reunified. So we came up with a number of sort of factors. And so those families would need to continue to have physical home visits, but also phone follow-up when they're not physically visiting. And then other families where the risk level seemed lower, phone follow-ups. And it was a real challenge, as a social worker. How do you do case management over the phone? And how do you provide therapy, in a place where, most people don't have phones, where the networks are not always reliable. We don't have the luxury of people having internet, so you can't do FaceTime or Zoom or WhatsApp. But so far, things have been going well for the most part, and I think it's because we've been able to continue the home visiting, while at the same time, taking measures. But then there was questions around, so how do you do social distancing when you're with a family, when they live in a slum? How do you even sit with them and talk. And so, you know, these are challenges that constantly emerge, and we have to constantly try to adapt and think through how best to do it. So it definitely has not been easy. But I saw there was a question about how did it work with families that we provided phones to, because in some cases they didn't have phones. Preliminary data shows that it did work, that they didn't sell them. They were really, really cheap phones. Maybe that's part of the reason why. And so, yeah, and the good thing about our context is as long as you have a SIM card in there, you don't have to have credit on the phone. As long as you can charge that phone, we can reach you. So it was also really about trying to strengthen as much as possible safety nets around the family at that time. So if there was neighbors that we knew that were strong supports for them, or relatives, or if there was a local government leader or community member or a volunteer, then it was really trying to engage them during this time. Not that we don't generally, but all the more now, to try to provide support and to also be our eyes and ears on the ground during this time.
Yeah, thanks. And I saw a question from the audience, from someone in the audience as well, around what you do in case family reunification is not possible.
We don't reunify, but this is the challenge now. When government demands you must remove these kids from the streets, and the only option to remove them is either to go back to a family, primarily. What do you do? So yeah, we don't reunify, but given that not everyone that was placed at the centers were reunified in the end, because like I said, it's not like they were detention facilities, those that we were able to reunify, we're continuing to monitor and follow up. But there is a real risk, obviously, that the reunification was done a little bit prematurely, given the pressure to remove them from the streets.
Yeah, thanks. So we'll move to Isabel now. You were mentioning a lot in your presentation how key it is to support families. So maybe you can tell us a little bit more about kind of the care that's needed for families and for, you know, children to be reunited with families.
Yes. No, obviously, many of the things that Shermin also mentioned is what we are encountering. We do really live in a global village. And in fact, what we are finding is that the kids that we are dealing with, they all have a family or somebody they call a family. Either it's, you know, the original family or the extended family, the uncle, the godmother, and so, you know, they have somewhere to go. And in fact, that's where we are now putting all our support is onto these families so that we can, first of all, I mean, some of them are families that we were visiting a little bit like Shermin mentioned, we were visiting them weekly. And now we have either through the phones, very cheap phones, and also we're providing some money for them to be able to have this contact. But how can we continue now? And I think this has given us lots of new ideas on how to deal with the new normality. But basically the support we're giving them is the therapeutic support sustained by phone. It's also sustained by, what we have to do is everything that we can do through a phone or through a computer. Not many have computers. In fact, if they had all have computers, we didn't need very much to be working with them. But some have from the office of, from some of the places where they're working. But we're giving them, with reading books by phone, with giving them video resources to the families that they can play on the phones. We've got something called Juco, from Juconi capsules, which is like a 30-minute, 30-second, 40-second message, which we are giving to the families. We also support them in their activities because the government had this program, which they're just now on holiday, but basically they've been at home all the time. So basically we help them with their school activities. we give each family food pantries for a month, which include all the sanitary needs that they have, the masks, the hand washing, the soap, the stuff like that. And we've also had webinars, which we have done, you know, for example, the state of Guerrero, which is one of the poorest. We have been giving webinars to the people of that state. And now what we, medicines, as I said, PPE, if people need, and so what we're now looking at is what is the new normal and how can we operate? What we did with our staff was that we thought there was no way we could send our staff to the slums or the places where these families live. So we continue to have them, the contact by the phones or by the computers, but instead of doing just one visit, we're doing various visits. We also have something called special time with the kids, which we are now, we know that certain kids are in very special needs and need special support because we've been working with them. And so we are providing that special care one-on-one with particular kids. But basically that's how really we are doing, and we are ensuring that they are in a safe environment. We cannot provide family with money, we don't do that. But we just give them everything that they need to be able to now be able to manage during the COVID, no? But in many instances, we can see the kids that are from well-off families have got a very different reality on COVID than our kids have. And so we are trying to really do our best. And I will talk a little bit later on the leadership we've taken in terms of Mexico, which is quite a lot in terms of advocacy and public policy. And basically, this is where we are in terms of now how to support the families in webinars that say this is a new normality. You have to look at everybody. If you give them some tools like, you know, count till 10 if you're going to explode, or if you're going to be, if you feel that you really can't control your emotions. We also have something which Shermin is quite familiar with, which is called the El Termómetro de Emociones. It's a thermometer of emotions, we could say, which has got the various, you know, the red, the yellow, and the green. And then we teach people how they can control their emotions. So before they, when we are talking with them about the way they can use this tool, we just say, you know, what you want. When you are really cross or mad, what do you want to do? Do you want to read a book? Do you want to go for a walk? Do you want to be in a corner and you don't want anybody to talk to you? What do you need? Give us 5 options. And so they have a card where they write those 5 options. And we tell them, when we feel you're going to go in yellow, think about those 5 options and have an agreement in the family how that works. Have a ritual. You know, if I say something like this, please leave me alone because I'm really getting out of control. So these are some of the tools. We've given them some of the tools so that they can use at home too. And the kids too, they love it. They actually think that it's a game. And so, you know, we are able to give them and to keep them in a safe, as safer environment as we can within the context of Mexico, which is, you know, yeah, it's incredible. Listening to Shermin and saying, you know, we've never locked down. Here we've never locked down, but we've got 3 colors. We've got the red, the orange, and the green. And we used to joke because all the time we were in the peak. Every week we were in the peak. So our peak took like more than a month, and we still, in most places, are still in the peak. And actually where I'm staying at the moment is orange, but Puebla is still red. So that means that people shouldn't go out, but it's just an advisory. It's a bit like, you know, in the UK too. But for example, Guatemala next door, they have a clampdown from 4 in the afternoon till 6 in the morning. And actually the police is outside picking up people and beating them up And really, that's not helpful because it's just, you know, putting a lot of strain in the police force, in the prisons, and doesn't solve any problem. In fact, creates more. So, you know, I think leadership and at government level and leadership from the NGO level that are respected is so important to move the agenda forward in this case. Thank you.
Thanks, Isabel. And that moves us into the final question as well. And we've also got another poll popping up now, which you should see on your screen now. So if you can let us know if there's any additional guidance that you think would be helpful, then please indicate so in the poll. And if you do find that that's useful, so if you indicate yes, then please let us know in the chat box kind of what that kind of guidance would be. But just to go to the final question, it'd be really interesting to hear a little bit more from the speakers, and please keep your answers short because we do want to address some of the questions from the audience after this as well still. But just to hear a little bit more about how each of you have engaged the government in promoting care solutions specifically for street-connected children during this pandemic. So can we, if we start with Vaibhav, if you can just say, like maybe in a minute or so, just kind of how you've been engaging with government. I know you addressed this briefly in your presentation already, but it'd be interesting to hear some very practical examples and especially successes, but also challenges of engaging with the government to promote care solutions.
This is open question.
Okay, if Vaibhav can start.
Yeah, I'm just starting.
Great, thanks.
Thank you. So you just say that please share this answer in very brief. But when we talk about India, this answer of this question is not very brief because we need to work on very level. First, at the government is not very much interested in NGOs work because they just think that what they are doing and what they are planning is just different things. So we need to work on various level. So what Safe Society practice, I'm just sharing the things that we work first at judiciary level, that if you feel something, there should be any change in the plan and system level, we approach to the judiciary as well. But the high level authority is very much supportive in India. So we also go to the high level authority, we talk to them, we motivate them, and the high level authority is always interested in the data and the factual and the research. So Safe Society is basically conducting the research at grassroots level. We just collected the data and collect the information, actual information, and meet to the government officials at the high level, and we just talk to them that what we can do at the grassroots level. So sometimes they just ask us that what we can start from the grassroots level. So we made the plan in the supporting of grassroots level organization. Like in the JJ Act in India, there is a District Child Protection Committee, DCPC, and the village level committee as well, which is called Village Level Child Protection Committee, and the block level. Block level is somewhere high from village, and then district. This is the organogram of in India. First starting unit is the village, then block, then district. After the district, it's a state, and after state, it's a national level. So from the top to bottom, we need to work, because if we made any action plan at the central level or the state level, it will not be implemented at the grassroots level. So we have to work on both level, and we are working at both level. First, at the state level, we just motivating the governments and government authorities to do the such and such things for these street children. And I'm just seeing the questions that what we can do for the not developing more street children. So this question may conclude this answer as well. So when we are working at the village level, the children are coming from the village at the streets. So we are activating village level child protection committee at the village level. And we are also, as per our research, we found that more than 70% of the children running away from their home because of the bad education system. So we are also strengthening the education system, the government public education system in India as well. So the village level child protection committee, the education system in the village level, we are working with them. And the livelihood problem. The children who are running away are the children who are living at the streets. More of their parents are very poor, and the trafficking region as well. The poverty is the region. So we are working for the livelihood as well. So we have developed a specific child-centric development approach, that from where we can work and connection with the government agencies and government schemes as well. So we are just putting the children in the center, and the children is connected with various government schemes. Not only the children, we are also putting his family or her family in the center, and we are just working with the government that which scheme will be suitable to support these families. So when they start getting benefit with the government schemes, and if their livelihood may be secured, so these children and these families might not come at the street. So we are working in the grassroots level, in the very ground level as well. And the advocacy level, we are working with the top level authorities that they need to emphasis on these activity and these actions. So the grassroots level employee and grassroots level government authority can do this type of action and support us. And simultaneously, we are in very part of very state level and district level committees, which is formed by the government, like special juvenile police unit exists in India. So, and anti-human trafficking unit as well. So there is the monthly review meeting for these two groups, and these two groups is responsible for all over the actions in the district for the child protection. And second, the district child protection committee as well. So we are the member in district child protection committee as well, and we are putting our view at the district level. And when we are talking about the state level, we are also in this committee, and we are putting our view, and we are raising the voices of these children at their level. But there are many problems in working in this system as well. So we also have good communication and good relation with the politicians, because when we go to the politician can support us in making the right decisions and do some support for these children, because after 5 years they have to come in the grassroots level to ask the votes. So we just motivate these politicians to support these children. So this type of activity at various level we are doing, at the judiciary level, politicians level, state and central level government authority, and grassroots levels as well. So these type of actions we are doing. Thank you, Liz.
Thank you, Vaibhav. In the interest of time, to leave some time for questions from the audience, I'm just going to move to Isabel. As we already heard from Shermin quite a bit around what they've done to advocate with government around the roundups and the importance of investing time with government and exposing government to the work that they're doing. So I just want to move to Isabel. If you could just give us one kind of key thing that you've been able to achieve through engagement with the government, just in a sentence or two, and then we can move to the questions from the audience.
Okay, I'll just give you a bit. First of all, everything we do is following the UNICEF, the UNHCR and WHO directives. We don't listen to any other directives because there is so much on the web that people, and we tell all the people working with us and participants that these are the only three sources of information we're going to follow. Otherwise, you know, it's crazy. We have, again, like Vaibhav in India, we work at the 3 levels. There's no way you can do work without having the 3 levels. The federal level with big policies made And I am in one of their coordinating bodies called the CPNAs. And I am in the coordinating body. There is only 5 people, 5 NGOs, but there's all the governors there and all the cabinet. So there is where the major decisions are taking place for children. And it's a 4-year appointment that we managed to get. So we are there, and we're taking we're influencing policy at many levels. The strategy for COVID that came out in the official bulletin a couple of weeks ago is one of the results of that. However, if you ask me, is that going to make a difference for our population? I don't think so, but it needs to be done, because then you have got the best practices that we all need to follow, so that there is something for us to catch. Then we have coalitions in Mexico. We figured out that if Juconi goes and talks on its own, doesn't make any difference. And they say, I'm just Juconi, okay, thank you. So what we do is we have various groups. We have one called Redeem, which is the Network for Children, and as an alliance of 77 organizations in 20 states. So whatever we decide at that level, and I am the president of that organization. So at anything that is decided at national level, and the things we decide that we need to push, we don't push everything, but we just push some strategic issues, and that goes straight down to the state level. I'm also the president of something called the RIA, which is the Network for Children and Adolescents. That is based in Puebla, where we have our central offices, and it's 22 organizations. Then we have one, this nationwide, that we are just members of the committee, which are 400 organizations. And why we do that? So when we come and talk, people listen to us, because we say we are 400 organizations. So, the union makes the strength. And also, we continue really to push anything that we need to do at municipal level where we are. So through these organizations, we push at state level and at municipal level what they need to do. So this is just an example. There are many more. We are in a network of cities, for example, and we know that 70% of the kids are in the cities.
I'm gonna have to stop you there, unfortunately.
I can, and also internationally. Yeah, we are in the Family for Every Child and your network. So, we gather information from all sorts to move the agenda.
Yeah, that coordination and collaboration is incredibly key to be able to really move forward as a coordinated whole. All right, so we're going to be moving to the Q&A now. I know we've only got a few minutes left. I hope you can bear with us. We might go a few minutes over time for those who are able to stay on a few minutes longer. Any questions that we're not able to address today, do send them to us afterwards as well, and we'll see how we can follow up on some of those questions, and maybe we can compile some of responses to other questions as well. We'll definitely be following up after the webinar, which Jess will talk about more when we wrap up. So there were a few questions from the audience around gender aspects, around sexual exploitation. So it'd be interesting to hear from the speakers kind of what's being done to prevent an increase of street-connected children being sexually assaulted, and any challenges in reintegrating, especially girls and adolescent girls who have been involved in commercial sexual exploitation. So anyone wants to speak to that briefly? Any experiences specifically with that, or has this not been an issue in your contexts?
I mean, go ahead.
No, go ahead as well.
No, go ahead.
Go ahead, Sherman.
So I think it's really important to have really strong safeguarding processes in place. And one of the things that we continue to do is continue to provide education to the children about what abuse is, where to go if there is abuse, how to report it. And at this time, that's been especially important. So that's something that we've been doing pre-COVID as well. And I was actually on a webinar, and one of the questions that was asked was, are you actually finding that you're not getting as many safeguarding reports? And in reality, we're finding the exact opposite. We're getting a lot of reports of safeguarding situations that are happening. So it's that ongoing education, and it's the ongoing awareness, but really it's the ongoing capacity building then of the frontline people to respond to that, that needs to also happen simultaneously. Unfortunately, this isn't something that is a quick response, but I just thought I would throw that out as an initial thought.
Yeah, just to follow up. This is an area where we are beginning to work a little bit more with more strength. It's in the past has not been very much an area where we work, but for example, the state next to us, Tlaxcala, has got the highest incident of kidnappings and even kids and mothers for organs and for sexual exploitation, and you name all the things that we know. So what we're trying to do is to train more people so that they are aware of and they kind of identify those things very easily. And also in terms of government, there's big billboards that say, you know, don't suffer alone at home. This is the number you can call. Of course, we all know that to have a call center is very expensive. So we're trying to encourage the governments to do that, because there is no way we could pay for that or have that. But basically also teach the young girls, you know, what this touching like this and that and the other is not real touching, and you should talk with your families, and so that, you know, everybody is aware that this exists and that, you know, is not okay. Are we doing the best we can? Possibly not. But, you know, we have to focus really on the things that we feel we can be better at. And so that's where we are. And also very much child participation there is very important, because many kids think this is the way it is. So, you know, how to involve children and to talk with their families, or to talk with the person that that is the caregiver or our therapist that is talking with them. So that's a complicated one, as Shermin said, but it's not one that we are, I wouldn't say we still have a long way to go on that.
Yeah. And are there any groups that are particularly vulnerable to abuse on the streets? There was one question that particularly referred to LGBTQ children and children with disabilities. Have you seen that these groups are particularly vulnerable to abuse, or are there other groups that you found particularly vulnerable, and how have you responded to that? Yes,
I mean, this is worldwide. You can see, I mean, also with the Black Lives, you know, movement. We are really, and when they say Black Lives, is also many of the Latinos are included in that, no? And so in that regard, we see a lot of that sort of exploitation. But no, we are not totally involved in that. But in fact, it's an area where we've been actually trained by our colleagues from Family for Every Child from Chile, where they've got a very solid program, and we are working on a big campaign in Mexico City with a coalition of other organizations on that. So, and Mexico, people are quite, you know, they're not so, depends on the states, they're very, some in the north are very conservative, but others, I mean, Mexico City is very open, and so, you know, there's, again, many Mexicos on that, you know, many permutations of that.
Yeah. And what is the situation in India? Are those groups particularly vulnerable, or are there other groups that you've seen that are particularly vulnerable, Vaibhav?
In India, we can see this type of groups, and at the street children, some of the street children in this community as well. So we are just supporting through counseling and support during this lockdown, and if we told specific about the COVID, so in the COVID, this community faced a lot of problems because their situation and their work is most totally affected. So we only supported by them counseling. Luckily we got passes from the government to move. We have the movement passes as well. So our staff moved and went there and just meet these communities who are linked with these LGBT communities and just counsel them. And simultaneously, if they need some medical support, medicines, and some care support, we have just provided this support. So this type of action we have just responded with this community. And definitely it's need more work with this community. It's, Isabel told that it's an international level phenomena right now. So definitely we need more work and more sensitivity from the government and general public as well.
Great,
But
thanks.
India, yeah, sorry, 10 seconds more. Because in India, the LGBT community is most vulnerable. If you think the most vulnerable, but in India it's most vulnerable because of the cultural problem and because of the religious way as well. And in government is also not very much familiar with these LGBT communities. So,
And what challenges do you face in responding to that vulnerability? Because I can imagine that with all the cultural context, it's not only that it makes them more vulnerable, but it might also be very challenging to come up with interventions around, this group specifically.
yeah, we got many challenges because this group is not came out easily. And this group is mainly live not open in such if we have just start the intervention with this community, they not came up and start talking with us, they just ran from us. So to intervene the situation and gain the trust from this community is very much hard in this community. So the gaining the trust is very hard, and after we get the trust from this community, the work will be very easier with this community and government as well. And most of the other society members or other societies also not saying the same things. They are saying that you are promoting wrong things. Sometimes the society is blaming us as well, that you are not doing good job, you are supporting wrong things, it's not good, they should not be supported. So this type of problem we are facing in India.
Yeah, I can imagine. All right, we'll pick two more questions from the audience before we wrap up the webinar. So there was one question that was liked by a few people as well, which was around how your organizations have been measuring the effectiveness of the adaptations that you've put in place during the pandemic. So maybe Shermin, if you can start to explain a bit how you've been measuring whether the adaptations you've put in place, whether those have been effective.
Yeah, so one of the things that we started to do is look much more closely at what data we were collecting and what data we would need to collect in order to continue to monitor. And so this was quite a vital part of what we discuss each week when we come together with our partners. So we're constantly looking at that, and asking ourselves what that means and what we might need to change or do differently. So in the interest of time, I'll just share that one, and perhaps others can also share there as well.
Yeah, Isabel? You're on mute. Okay, I should try and speak. Yeah.
Sorry about that. No, we have got a very robust measuring mechanism for the 30 years we've been working, but the last 10 years we've really been refining it. So we are just we have been using that to continue to see how we are working with the families, and on the basis of that we will be measuring our adaptation. But up to now, we really have not had time to do that, but we will, because I think it's important. But this also will lead us to work in a different way. We might have visits and telephones and, so that we're not just going to do one intervention like we were doing. We're going to, the world is changing and we have to change with it and we have to adapt. And I think that's where we are in our thinking. Also in some of the ways we work, we took the time of this COVID, and maybe this is a good tip for everybody, to sit down and see how we work, and look at our mission, our vision, our values, and say, are they still okay? Or do we want to change them a little bit and do include more interventions in this area or that area? And I think it's helping us actually to work differently and work, in fact, more effectively. I mean, it's a bit death by Zoom, but we'll have to see how it goes in the new normality, so we can really take the opportunity from the things that work very well and get rid of some of the things that we might find obsolete by now.
It in a way provides an opportunity to reconsider and review everything we've been doing. Yeah. Vaibhav, did you have anything to add to that on measuring success and effectiveness of adaptations?
I think the previous speakers has covered all the points. We are just exploring the words because it's new for everyone. We are just exploring the words to how we can do the Zoom calls and WhatsApp and all these electronic mediums are not very much easier for these children. So I think the same which we were working, we have to change some basic work pattern, but more or less we have to interact with children by physically, because they have only reach in physical. So, and for the monitoring purpose of this adaptation, we are just exploring the things, what new we can do and what can be done, especially. Rest of the thing is previously, nothing, some extra we are doing. Thank you.
Thanks. Yeah, and just to kind of follow up on that and to wrap up, one last question is to maybe just really briefly tell us in a few sentences how now moving forward in the medium, longer term, as we move towards, hopefully soon recovery from the pandemic, how do we now, or what kind of do you kind of suggest that we as organizations working with street connected children, and especially in your context, what are you looking at to improve in the longer term with care solutions? What needs to happen for street children for this new normal that we're now moving towards too?
Actually, this new normal, two things are here. First, we got that most of the street children has got some specific space in these pandemic situation. Most of them shifted in open space like railway, I told. So somewhere they got space. It's not permanent space, but it's temporary space, but somehow they got space. So we are just planning to not to come back at them at the street. So we are developing their livelihood plans, what they have, what skill they have. We are just exploring the skills in their children, and we are just supporting, facilitating by training, by providing support money and establishing their businesses and whatever they want to do. We are just doing these things. So I think child-centric and individual-centric plan would work with these children. And earlier it's the same, but during this lockdown, the children are more, we can say that they are more sensitive for their jobs and for their livelihood. Because earlier they just thinking that they can earn money from anywhere and everywhere for any way. But right now they are thinking that all the ways is right now the set. The only way to get the money is to do something for their own livelihood, or establish some venture, or do some job, or get some technical know-how, and by technical know-how they have to work from there anywhere. So in this way they are very willing as well. So we are working on these characteristics right now, so they can work on it, upon it. And as you know that art-based therapy which we are using in India, this is nationally known and nationally recognized by the government President of India as well in last year. So the art-based therapy is very much supporting for these children, because the mental trauma is right now mental trauma is going up in this situation for these children as well. So to reduce the mental trauma, we are just doing art-based therapy with these children. This might be helpful. So art-based therapy and individual plans will work. So we are working on it.
Thanks, Vaibhav. And Isabel, what would you say is the one thing needed as we move towards a new normal, talking about care solutions for street children?
Yes, interesting what Vaibhav said. You know, I worked in Nepal for 10 years, and I know the reality of India very, very closely. The one thing I would say, we have to redirect our resources. We are thinking now, for example, do we need to have all these centers where the kids come to us? Or do we need to provide, in these cases now, we're providing money for Ubers, but, you know, I just saw a message from Uganda, you know, how do you move from one place to another? We don't have the problem because there's no lockdown, so everybody can move. So, but we're providing money for some of them to come by Uber, so they're not exposed to COVID. But this is luxury. But what we're saying is, maybe, you know, following the guidelines for family reunification that we've all supported, is to say, okay, do we need, maybe we have to start thinking of virtual houses. How can we have a virtual house instead of a real house, and do everything we did in the real house, but virtually? So that's my sort of 5 cents for this, you know, think virtual and redirect resources.
Very forward thinking, yeah. And Shermin, anything you want to add to that as key things as we move forward for care solutions for street children?
We're going to have to keep being creative and building awareness and capacity, you know, especially of the decision makers, but also of the frontline workers, and continue to strengthen alternative options to family-based care, because as you've all rightly pointed out, it's not always easy to return them to their families or their extended families. So what other options do we have? And I would say remain flexible, be willing to adapt, and be willing to be proven wrong.
That's a great note to end on, I think. So I'm just going to hand over, in the interest of time, back to Jess to help us wrap up the webinar today.
Thank you. Thank you so much to Shermin and Vaibhav and Isabel. As you can see, we had lots of questions that we haven't been able to get through. So I've made a note of the questions that didn't get answered and all of the suggestions that people have put into the chat for follow-up webinars. There was an overwhelming response that would be something that people would be interested in. So we'll send out a follow-up email to all attendees with the recording and with contact details. You can see they're up on the slide here now if you have any other questions. And then once we've had a chance to look through all of your suggestions and additional questions, we can think about what would be useful in terms of a follow-up session. Apologies again for running over. There was just far too much interesting discussion to be had and interesting questions. So once again, thank you so much to the speakers, and we'll be in touch soon, and thank you for keeping with us. Thank you, everyone.
Thank you very much. Bye-bye.
Thanks.
Okay, bye-bye.
Thank you.
Okay, bye-bye, Shermin, Jessica.
Bye.
Thank you.